Hey guys, ECRG here. How can study coordinators break into a CRO? Hey guys, ECRG out here, back with another video. Today we're going to be talking about how study coordinators can break into a CRO. Now, a lot of people are interested in moving up the ladder there to a CRO, particularly because there are a lot more opportunities in a CRO than typically at a site. You can do a lot of different jobs. You can go into regulatory, you can be a CRA or a CMA or an in-house CRA, or you can even go to the project management side. Now we're going to talk about the easiest pathways for a study coordinator to get into a CRO. And well, there's not really super hard ways, but everyone has got to get their foot in the door somehow. And we're going to talk about some of the easiest pathways. So one of the easiest ways for a study coordinator to get into a CRO is obviously to either be an in-house CRA or a CRA. Probably in-house CRA being the easiest, depending on the market. Now, right now in 2018, it kind of seems like in-house CRAs are in demand. CRAs are always in demand, but typically you're going to have to get into a training program unless you're a really, really experienced study coordinator, like 5, 6, maybe even 8 or 9 years of being a study coordinator. Then you can go directly into CRA. But usually they like to train you first. So in 2017, if you recall, a lot of CROs had programs to train people that were study coordinators. Even some sponsors like Merck had a program. And I remember specifically, they wanted study coordinators with maybe 1 to 2 years of experience. They weren't looking for anybody else. They didn't want no in-house CRA. They didn't want a CTA. They didn't want a project coordinator. They wanted study coordinators. So when the market goes through something like that, that's your chance to jump on it. And if I were you, if I was a study coordinator, I'd go to be a CRA because they treat you like royalty there. And then it's a lot easier for you to jump to other areas of the business because CRAs are making the CROs most of the money. That's where the money comes in. And so as a rule of thumb, if you're where the money is, you're going to be treated very well. And CRAs are always treated very well in the CRO because they're making most of the money. That's how they make their money, is by monitoring. So if I were you, if I was a study coordinator and you're given the opportunity to go to a CRO and be a CRA, I would jump on it, even if you're not interested long-term in being a CRA, because it's going to be easier for you to deploy that background in other aspects. It's easy. They make CRAs project managers all the time. All the time. You could be a CRA too, maybe a senior CRA, and they'll jump you over to project management without hesitation. That's just how it is. But if you're coming up from the bottom trying to be a project manager, it can be a lot harder than if you're a CRA. That's just how it is. They treat CRAs really, really well, and there's a lot of clout with being a CRA too, because they want to make sure that they keep you around at the company. If you're a CRA, so that's probably the best option. And even if you're not interested in being a CRA long term, you can use that to go to exactly where you want to be, whether regulatory, data management, statistics. I mean, you name it. Any part of the company, advertising, business development, you name it. I would get your foot in the door being a CRA if you're a study coordinator. Now, some other options you have is, especially with the new GCP E6R2 regulations, is there's going to be an increase in the number of in-house CRAs. And we're already seeing it. We've got companies like Syneos Health hiring a bunch of in-house CRAs. You've got even companies like Quintiles or IQVIA, who's bringing back the in-house CRA position that they did away with. So you've got a lot of companies that are going to be focusing on in-house CRA. That's going to be a good one for you to get your foot in the door if you're a study coordinator, because you're working with these people on a day in and day out basis, more so the in-house CRA than the CRA, even though the CRA goes on site. But they're typically busy monitoring. So who do you normally talk to? The in-house CRA, because they have availability. So that's a very easy jump for you to make because you've got experience working with them already, and they're going to do that no problem. But the CRA is a better jump because you're going to make more money as a CRA, and they're probably going to keep your salary the same wherever you go. So if you go to a project manager level 1, you're probably going to make more money as a CRA. So they're going to keep your salary the same. If you go in-house CRA, you're not going to be paid as much as a CRA. So it's better to go to a CRA than an in-house CRA. And then they're going to keep your salary the same. So CRA is by far and away the best option for you to get in if you can. And it depends on the market. Right now, the market's good for in-house CRAs. So if you wanted to make that jump, go ahead and make that jump to being an in-house CRA. That's not a bad option as well. And then, so those are the best two options for study coordinators, particularly because they work with them day in and day out. And it's very easy to convince a CRO to hire you if you are a study coordinator and you work with those positions. They know the relationship is there, and it's very obvious for them to hire you. It's a very good fit. And then those are probably the most common ways that study coordinators get into the industry, just because they're on the clinical side, study coordinators and CRA and in-house CRA. So those are very good options. I have heard of people and I actually work with people who were study coordinators before and are now in-house CRAs. So that's a very common path as well. Also, some other paths are you could go the entry-level route if you want to. Entry-level CTA. I mean, they're probably not going to put you in as entry-level if you have experience, but they'll probably put you level 2 or a senior or something like that. But you could do that if you're not interested in monitoring. But those are probably the best options. Staying on that clinical side is going to be the easiest and the lowest path of resistance, most likely. And then you just go from there. If you want to, wherever you want to go in the CRO, just do that after you get in on the clinical side, preferably CRA. That's your best bet by far. Now, if you're interested in going to the sponsor, they also have CRAs actually. So back in the day, sponsors used to do everything. They used to basically be the CRO as well and run their own trials. But somehow companies broke out and realized that they could offer the service to the sponsor. The sponsor can just focus on creating the drug. The CRO could just focus on bringing it through the phases of a clinical trial. And so they realized that was more efficient and that was more cost effective. So that's the model we have now today. So you can go to the sponsor as well and be a CRA. But obviously you don't have as much contact with the sponsor. You have a lot more contact with the CRO. So it might be better for you to go with the CRO just because you're more familiar with working with them and for them. So that's just something to keep in mind as well. But they do have CRAs and they do have other clinical positions as well that you could check out. But I always like looking at the path of least resistance. What's the lowest barrier to entry? And let's see if we can attack that. So CRA, in-house CRA, maybe some other clinical positions, clinical trial assistant, if you want to go that route as well. And you can do project management side, but I would much rather prefer you guys getting in as CRA and then moving on to wherever you go, because your salary is going to be high and you're going to be treated just way better if you were a CRA. So that's it for today's video, guys. Like this video, share this video, subscribe to the channel, email us at eliteclinicalgroup@gmail.com for any reviews you may have, for any inquiries you may have. My bad. That's it, guys. Take care.